Hello friends, today I'm going to talk about the one of the intrauterine device which is a part of family planning method, that is Levonorgestrel Intrauterine Device which can be used for long-term pregnancy protection almost for 5 years. Okay, so inserted into the uterus by a specifically trained provider. Okay, so a well-trained person can do this procedure for inserting the device into the maternal womb or maternal uterus. So what is Levonorgestrel Intrauterine Device? Let's discuss. So the Levonorgestrel Intrauterine Device is a T-shaped device. Okay, it's like a copper T, but in this is a T-shape which is made up of plastic device that steadily release a small amount of hormone which is levonorgestrel each day. Each day it releases the hormone. So this levonorgestrel is a progestin hormone also used in some contraceptive implants and also used in oral contraceptive pills. So a specifically trained health provider can do the procedure for inserting the intrauterine device into the uterus through the cervix. So also called levonorgestrel releasing uterine system, another name, and another name is hormonal IUD. IUD means intrauterine device. So this is marked under such brand name like Mirena, Liletta, Kyleena, Skyla, and JDS. So this Kyleena, Skyla, and JDS IUD, and their inserters are slightly smaller than the Mirena and Liletta. Okay. It works by preventing the sperm to fertilize the ova, or also in common terms is called as egg. So it prevents from fertilizing the sperm to the ova. So how effective this is? Almost around, if 100 women is using this kind of IUD, less than one women have a chance of pregnancy. So almost 99% of cases success rate is there. Okay. Then some of the side effect, if mother might develop. So what are the side effects? Let's see. Some user report that most commonly changes in the bleeding pattern. So including lighter bleeding, or some women might get heavier bleeding, okay, infrequent bleeding, no monthly bleeding, or prolonged bleeding. And the other symptoms or signs might develop like acne, okay, headache, breast tenderness, or breast pain, or the nausea, feeling of vomiting, weight gain, dizziness, okay, then mood changes. These are some of the side effects. Then other possibly physical changes like sometimes ovarian cysts might develop, and uh, they were very rare case, in the rare cases. Okay, then let's see some of the benefit. What benefit if the women get or use this IUD? So it helps protect against obviously pregnancy, right? And also iron deficiency anemia, it protects. Risks of pregnancy protected, and as well as iron deficiency anemia, and maybe may help in protect against what endometrial cancer or cervical cancer, may protect. Also reduce the menstrual cramp, that pain, okay, heavy monthly bleeding it reduces, and symptoms of endometriosis might reduce, okay, like pelvic pain or irregular bleeding, okay, and the risk of ectopic pregnancy is reduced by using this. Some other health risk factor like, but very rarely may get. So in the short term, PID means pelvic inflammatory disease may occur. May occur in what case? If a woman has and having infected with sexually transmitted diseases like gonorrhea, chlamydia during the time of insertion. Okay, so this PID might develop. And the complication, if women develop, then what kind of complication might develop here is very rarely, but rarely, uh, puncturing. Puncturing means perforation, like little bit of trauma in the skin or the layer of the endometrium while during the procedure. So during the procedure, if an instrument is applied, then sometimes it might puncture the uterine wall. So very rarely this complication might occur. And other case like very rarely miscarriage might occur, preterm birth or infection in the very rare case that the women become pregnant with this levonorgestrel IUD, intrauterine device, okay, in place. So this all about the complication, side effect, and also the benefit of this IUD. So let's see some of the misunderstanding. Let's correct some misunderstanding what people have. Okay. So levonorgestrel IUD, this can be used by women of any age. Any age means those women who are under the adolescent or under the reproductive age can be used in case if they want to have a gaping or family planning, um, for the during her family planning methods. Okay, so this kind of method can be used by the reproductive age, any of the reproductive age group, if the couple has decided. Then also it can be used by women who have had children or who doesn't have a children also. And also do not increase the risk of contracting STD. STD means sexually transmitted disease, especially including HIV. Okay, so and also do not increase the risk of miscarriage when women become pregnant after the IUD is removed. When the women, if the couple have decided to plan a baby after a few years of gap, so they remove the IUD. After that, when the women become pregnant, there is no chance of miscarriage. Okay? So this is the misconception which is clearing out. And do not make women infertile after the removal or after the insertion. After the insertion, during those period, the fertilization is protected, but it doesn't mean that the woman is infertile. Also, do not cause birth defect. It doesn't cause cancer. It doesn't move to the heart or the brain. Okay? Or do not cause discomfort or pain for the women or the men during the intercourse. Okay, let's wait for the next video for more information. For today, take care. Bye bye.